Good afternoon. It's Dr. Renee here with blackdoctor.org. Today is Lipoprotein A Awareness Day. So I know I just lost most of you, but
Mhm, mhm.
that's why we're here. We're going to learn all about it today, and we are going to learn about it, and then we're going to talk to our doctors about it, more importantly. So please stay tuned. But as usual, housekeeping, you must share the broadcast because sharing is caring, and this is going to affect many of us. So please share the broadcast. And then also, as always, please type in the chat and let us know where you're watching from. And last but not least, if you have questions, please type them in the chat and we will try to get those addressed. Okay. So please share, let us know where you're watching from, and type in the chat any questions you have. So I'm so excited. We have an expert with us today that is going to teach us all things lipoprotein A. So, hi, Dr. O'Feely.
Hey there, Dr. Matthews. Thank you for having me.
Thank you for joining us today. So, first of all, let's just get it out of the way right away. What exactly is lipoprotein A?
Very good question. And your audience is not alone in asking that question. What is lipoprotein A? Well, lipoprotein A is actually a type of cholesterol particle, and we have known about it for a long time, but more recently have had an opportunity to begin to take a second look because of all of the various associations. For example, every single one of us know when we get a cholesterol test, we get what's called an LDL particle, which is the bad cholesterol. Well, the lipoprotein A is similar to the LDL, but it has a special additional apoprotein attached to it, which is where it gets that little A name to it. Unfortunately, that also results in a particular feature of this lipoprotein, which makes it stickier. So it does lead to more risk for heart attacks, strokes, and blockages of the arteries to the legs. And we'll be talking some more about that.
Uh-oh. Okay, so now if you don't know, you have vessels in your body, everyone, and the blood is supposed to stream right on through, nice and seamlessly and flawlessly.
Yep.
But when people tell you you have hypercholesterol, that is what it is. You have blockages in your arteries, so now they're not smooth. There's stuff coming, around them that makes them sticky or whatever, and so then the blood can't flow, which
Leads
leads
to
to obviously heart attacks and
yes.
clots in the legs and in other places. So unfortunately, that's an
Yep.
awful thing, but that's what happens. And so that's why it's really good for us to understand exactly what lipoprotein A is.
That's
So, Dr.
correct.
Ophelia, what makes you the expert on this?
Thank you so much for asking. So, I am a cardiologist and I'm what's known as a preventive cardiologist, which means I study things that can affect the heart and the blood vessels. And as Dr. Matthews just said, there are blood vessels all over. As a preventive cardiologist in my practice, I have people come up, and generally once a year, we would check all of the potential factors in a blood test to see how we can reduce the risk of a heart attack. Now, some of these factors are genetic based, and some of these factors are just what happens in our environment, whether it's our diet, exercise, etc. I want to put it up front, Dr. Matthews. So people sometimes come up to me and say, well, I am so tired of everybody telling me of all the stuff that's bad about us. There are actually a lot of good things about us, and by that I mean all of us that are of African descent. For example, we know that lipoprotein A is actually can affect about 1 in 5 individuals. The ratio is higher for individuals of African descent. Now, with that, that is not necessarily, obviously, a death sentence. As I stand before you, I myself happened to find out because my daughter asked me to check it out that I have high lipoprotein A. Now, you would wonder and ask, well, how does a cardiologist not know that? Well, I get my LDL levels every year, like most people. The recommendation is to get it checked. Anybody who's 18 and older to get it checked every year. And my levels, I know I have to work a little harder with exercise, with my diet to keep it under control, but it was nothing bad. But my daughter, she happened to be at a conference and they were talking a lot about LP little a, so she just went and got hers checked. And it was over 200. And somebody is going to ask, well, what does that mean? Well, the levels, depending on how they're measured, sometimes have to be under 125, and another kind of measurement, it has to be under 50. So when you get under 200, over 200, regardless of how it's measured, you know it's high. And she got really worried. And I said, well, you just need to do all these other things. And again, Dr. Matthews, we'll have some more conversation about what we're trying to do with the African American Heart Study in a way to understand this better. But the bottom line is, she talked about this so much, I had to go get myself checked. And guess what? My level was about the same as hers, about 215, just, give or take a few points. Now that's surprising because obviously I'm much older than she is, and we know cholesterol increases with age. But what happens with lipoprotein A is it is stable from around 5 years of age. It is genetically determined. No matter how wonderful your diet, how well you exercise, it's going to remain that number. So that's a big part of why, and again, I'm so pleased you have this March 24th Awareness Day that this is going to be a big conversation. That's because again, some of the things I'm going to talk about in this conversation is around prevention, and we'll get to that. And so that's my story. And the bottom line is I'm paying a lot more attention. Where I would have maybe helped myself to something before, I'm saying you can't. Whether you're on medications for cholesterol or not, all of our current medications don't work for lipoprotein A. So this begins to enforce a conversation. Do what my daughter did to me. Ask your doctor, what is my lipoprotein A, so you can see where you land on that spectrum.
Oh, wow. Now, I didn't know there was no medication. That is very
Not,
interesting.
not, not yet. Not
Not
yet.
yet. Oh, no, I know that
Right.
everything is, evolving these days.
Exactly.
There's so many new things coming out on the market.
Yeah.
But I definitely know, and I'm very familiar with the fact, and I'm sure many of us know, and maybe they don't know, that cholesterol can be quite familial. And, you could be somebody who, I had a friend in med school, picture of health,
Hmm.
exercised, but he had high cholesterol at 30 something years old because it was familial. It was just, and he had to take medication because it was in his genes. That's the way it was. So, you have to, this is why, as we say so much on Black Doctor, you must go to the doctor at least once a year,
Yep.
and you have to know your numbers. And one of those numbers is cholesterol, your HDL and your LDL. You need to know the numbers
Yep.
because once you know those numbers at that doctor can then refer you to a Dr. Ophelia, a cardiologist.
That's right.
And you heard her say she's a preventative cardiologist. So she is trying to help you to stay away from having a stroke, a heart attack. She wants to help you to get your heart to be pumping correctly so that you don't have to worry about these things.
Exactly.
So, this is why it's so important that we know our numbers. These numbers are important, and it's the best thing to do is to understand them. But if you don't understand them, please get someone on your team as far as your physician. Get a good physician that knows exactly what's going on with you so that they can recommend, refer you on to who you need to go to, because you need to make sure, you can imagine you get blocked arteries. That's
Hmm.
when you lead to all these different things. You might not have a heart attack, but then you might be killing parts of your heart and have to have heart surgery. And so no one wants to do that. Okay. So that can be very costly, time off work and all of that stuff. So please, please, please go to the doctor.
Yeah.
So let's talk about the specific signs and symptoms that might indicate someone has high levels of lipoprotein.
Essentially, what's interesting, unfortunately, is the signs and symptoms are very subtle. Other than the blood test, you may not have anything else going on. As I just mentioned to you, I can't say my age because that's not polite. But I am not a young person. I have been in cardiology practice for 30 years, so you can do the math. I don't have high blood pressure. My weight is appropriate. I exercise regularly, so I don't have any sign or symptom. So a lot of it is really about knowing, as you just said, Dr. Matthews, and then prevent. I want to encourage people to go to this website because it has a lot of very good information. It is called the AA Heart Study, www.aaheartstudy, all of it together.com. When you go to that website, you'll hear me talk to one of my patients. He is essentially in his 30s when he came to see me because he was concerned that, he's having pain in his legs. And if you listen, you'll hear him say, I was just getting ready to go to work. And then I was so tired, I had to sit down. So fatigue can be a sign not of the lipoprotein A or cholesterol elevation itself, but of something else that has happened because the levels were so high. In his case, he did have another risk factor. He smoked. But a smoker at the age of 30 or 40 should not be having a heart attack if other things are not going on with it. Obviously, we don't want people to smoke because all of these risk factors go together. Bottom line is, he was referred to me, and I said to him, well, guess what? You have had a heart attack. He was shocked. I said, that's what I find on a test, and now we need to run some special tests to see why you had this at such a young age. And I told him, smoking has got to go away.
Mm-hmm.
Thing is, I said, guess what? You do have high lipoprotein A. So in his case, because he's already had a heart attack, we now had to put some medications on, but that was primarily to control his LDL. And I explained to him, I said, this is now a matter of managing all of these lifestyles. And he talks about that in that video. And I just really encourage people, we can put that website information up. You learn some more about the African American Heart Study, how to be a part of it. You learn about lipoprotein little a, what you should be talking to your doctor about, and some of the things that we've shared here today. But you'll also get to hear from a young African American man who was really scared when I told him this is what's going on. But subsequently, I worked with him, his mom. We calmed him down. This is not a death sentence. You have a whole life ahead of you, but now we know we have to make some changes. And he was up with that, and he's doing very well.
Oh, well, that's good. But yeah, that's very interesting. But a lot of I know somebody else who exercised regularly, was actually out on the court playing basketball, and went home, and I guess wasn't feeling quite right. Ended up going to the hospital and found out that he had had a heart attack,
Hmm.
but
Hmm.
he didn't even know.
Yep. Yep.
Yes, so
Yep.
it blows my mind, but it happens way too frequently. We, as African Americans, we walk around with the highest of blood pressures and have no clue.
Exactly.
I mean, black people just walking around and blood pressure 180 over 100, and
Yeah. Yeah.
just you have, and that's another number you need to know. You need to know what is your regular blood pressure,
Yep.
so that when it is high, you know that it's high.
Yes.
Also, blood pressure monitors are not that expensive, everyone. Please, Amazon has them, drugstores have them. Get you a cheap blood pressure monitor. They have all types. They got the wrist, they got the arm, they have everything. And
Yeah.
then they have them that will talk right to your phone and record the readings into your phone. So you
Yep.
don't even have to remember to bring the piece of paper to the doctor. You can just
Exactly.
bring your phone and show the doctor, these have been my blood pressure readings. You guys don't understand. Wouldn't you appreciate if your patient did that?
Absolutely. And you just said it. It's about how do we empower ourselves as folks of African descent, not to be, say, well, I don't want to know, everything's always wrong with us. Everything is not always wrong with us. A lot is right with us. In fact, you could say it's amazing that many of us survive as long as we do, given all of the
Right.
external environment, the racism, the being just sort of ignored. or not listen
The
to what.
daily stressors of life.
Yeah,
Just
but if
walking. Look,
well,
driving while black, walking while black, running while black.
right. But Dr. Matthews, even as we're telling our folks to go to the doctor, sometimes you have to ask the questions more than once.
Mm-hmm,
Because
mm-hmm.
sometimes when you go, I've had patients tell me, especially women, because they don't have all of these symptoms, they show up with some vague, they're tired, they're not feeling right. It's my body, so I should know. Then you go in and the doctor goes, there's nothing wrong with you. And some people have been in the middle of a heart attack. So it matters to know, as Dr. Matthews said, what is that blood pressure? Because some people unfortunately think, oh, it's just 150, 160. That's not a problem. You're a black person. Your blood pressure is supposed to be higher. No, it's not. Then the other thing is, if I'm of the age and I have all these, maybe I'm overweight, and I mentioned to you that I have diabetes, well, don't just send me out, check an EKG, because that's not something you pick up with your stethoscope.
Yeah.
You know?
So it's really, really important that we know this information. And like I said, you can get a blood pressure monitor. It'll speak directly to your phone. It will record everything for you so that you have that information. And so when you're asked, you can say, oh, my blood pressure is usually such and such, because you can see all the readings.
Yeah.
Um, and also, you can notice if it goes up. You yourself can see and say, oh, I should call the doctor because my blood pressure is up. And you might already be on blood pressure medication. So
Yep.
maybe the medication needs to be changed or something. So
Yep.
you need to know. And like she said, not all bad things happen to us. You could start changing your lifestyle and your blood pressure starts going down. Well,
Yep.
in that case, you need to call the doctor and say, hey, my blood pressure is going down. I think maybe I need to, get off of this medication. And guess what? You might be able to get off the medicine or
Yes.
a lesser dose. So this
Yes.
is why it's so important that we just know this information. And like I said, blood pressure monitors are not expensive. There are expensive ones, but you don't have to buy an expensive one for it to be a good one.
Yes.
And we
I
really should check our blood pressure regularly. That once a year at the doctor's office is not necessarily the best thing. You need to check it a little more than that. Not to mention, as I'm sure Dr. Ophelia is very familiar with, there's white coat hypertension. There
Yep.
are some of us that will walk into the doctor's office, blood pressure be just fine. But as soon as you see that person in the white coat and taking your blood pressure, now it has shot through the roof.
Yep. That's
And
true.
so that is not an accurate reading, obviously, because if that's not what your blood pressure would be normally, and so now you've got this high blood pressure in the doctor's office, well, they can only go off of what's in the office because you didn't bring them any other readings. So
Yep.
that's why it's so important for you to give them a whole bunch of readings so then they can say, oh, you just had white coat hypertension. We don't need to prescribe anything. Your blood pressure is always in the normal range.
Yes. And I want to say, and I 100% agree with everything you just shared. But what I hear underneath that we need to emphasize is you must get it checked. So sometimes people go, oh, it was fine the other day, so I stopped my medication.
Oh,
Oh, am
God.
I going to have to be on this the rest of my life? Am I going to have to do such and such? You need to respect that number, because the fact that it's even going up sometimes in the doctor's office may mean that it sometimes goes up when you're at home and having some bad argument that you're not interested in having. So that's why I 100% agree with Dr. Matthews. It is not for you to be anxious about it. It is for you to feel empowered, knowing the range of numbers you have and keeping track so you can educate your doctor about your own body.
So, what lifestyle or dietary changes can someone make to manage their lipoprotein A, since we don't have a medication on the market yet?
Very, very good question, Dr. Matthews. And I noticed that we are streaming, showing that website, and I
Yes.
appreciate that for everybody. That aaheartstudy.com. You go there, you're going to find, as I said, some information to help you understand better. But to answer your question, Dr. Matthews, the lifestyle is really about what we've been talking about for years. It is about exercising, diet, and I, like I told you, my level is high, and I am not a plant-based person. I love my meat. Not necessarily red meat, but I gotta have some meat. But
Right. I get it.
now I know I can cut it down, and maybe I have a lot few more I have more salads, more fruits, and then I also try to, cut out meat a few times. Those do work. But at the end of the day, you do want to find a balance where you can sustain it. The other piece of good news, though, is, and I should mention that even though I said there are no medications in terms of drugs to take or, shots to take to get it down right now, if your level is a certain high level number and you have what's called familial hypercholesterolemia, which means you already have family members that have had this premature heart attacks or strokes or blockages of the leg arteries, where some of them even had amputations, those are all warning signs to ask the question, is there something else? There is a way to actually try to pull the cholesterol out of the bloodstream and the particles out of the bloodstream. It's called apheresis, apharesis. It's just one major effort to make sure the levels are down, and they do it every so often. You may fall in that category depending on what your level is. Mine is not at that level because I've not had a heart attack. But if somebody's coming up and the level is high and they've had a heart attack, they would likely be recommended while we're waiting. APHA. So the after the H is A. Thank you.
Got it.
Thank you so much. I love your instant typing. So the other thing I want to mention is, fortunately, and both the African American Heart Study sponsor, which is Amgen, as well as other pharmaceutical companies, are now taking a serious look, because there are many different ways and drug targets to help get LP little a down. Those studies are ongoing. I am not here to promote any of the studies, other than to let you know that we believe in a few years we will now, when I come back to Dr. Matthews, we will be talking about how have whatever the different drug studies looking, especially for African Americans. And I want to say to all of us, if you have an opportunity to join a study, ask a question about your doctor. Would this be of importance? What do you think I should do? But talk to others like me who have a special interest in representation of Blacks and other minorities in clinical trials. It is now a whole field, because everybody agrees, Dr. Matthews, as I know you do, if we're not tested like everybody else, how do we know that this medicine would work for us? How do we know that the side effects are not going to be worse for us? So that's, again, that's a little bit of the other half of my job. I can't come up to a panel without sharing it. If people approach you or you have a question, I will say, when you go to that aaheartstudy.com, we have the Health 360X, which has a link, because that's how we also promote. That's a shameless plug, Dr. Matthews. Thank you so much. But that's how we also let people know all the things we've been talking about, whether it's managing your blood pressure or your lifestyle, how you track it with our Health 360X app, and share that with your doctor, family members, or anybody you want, like a coach. At the end of the day, everyone, I love the work that Dr. Matthews does with blackdoctors.org. She's bringing the message out. But until we agree that we have power to take that message and make ourselves better, then that message is in vain. And I know you don't want Dr. Matthews to be working in vain. So let's go.
Yes, exactly, exactly. But yeah, we do. We preach on here about clinical trials. We actually, blackdoctor.org participates in clinical trials with recruitment. You can go to our website, blackdoctor.org, click on clinical trials and see if you qualify for any. But it is so important. And actually, I speak about it all the time, but we have a cardiologist today. There is a hypertension medication on the market that does not work well for Black people. Is that correct?
That is correct. There are medicines that, like you said, does not work as well. It's not that it doesn't work at all. We have a certain kind of hypertension. There have been debates around it, but we are more salt sensitive. And before anybody jumps up and down and says, well, that's again, we're being separated out. No, we all come from a certain place.
Mm-hmm.
Our bodies have been conditioned to survive in that environment, and then we're brought to another environment where we're dealing with new kinds of stressors, a lot of issues around food that wasn't there in our original environment. So we do tend to hold on to salt a little bit. So if medications are not targeting that salt sensitivity part, it may not work as well. All blood pressure medicines work. The data has shown that sometimes there needs to be combination, maybe a little bit of a low dose diuretic, maybe what's called a calcium blocker in the mix for blacks, especially if you have a very strong family history of high blood pressure, as I do.
Yeah, see, so that's why clinical trials are so important for us to participate in. I
Yep,
know that people are like, oh, Henrietta Lacks and the Tuskegee. Trust me, in 2024, it is extremely important
yep,
that people like us participate in clinical trials, because what we do not want to happen is drugs to go to the market that were never tested on any Black people.
yep, yep. And Dr. Matthews, I know you have had this experience as well, where people come ask you a question, even if, it's not a trial that you're involved with. And that's what's important now, because there are now these safety measures around what is the permission that you as an individual gave to be in that study. What kinds of questions do you have that has not been answered? And again, the more you listen to blackdoctors.org and Dr. Matthews, you learn new things. I continue to learn new things. There's nothing wrong with that. But once you find out something, go ask a question. Don't
Mhm.
sit on it. And I agree that sometimes that in the past there have been clear abuses. I don't think we could sugarcoat that. But now we are in a situation where a lot of development is taking place, a lot
Yes.
of discovery. We want to be a part of that discovery.
Yes, definitely. And we want to make certain that, this is a way our voices can be heard. And my
Yeah,
other last thing on clinical trials, don't wait until you are sick.
yes,
Go do it now.
yes,
It's awful that, so and so went through all these treatments and then they went to the clinical trial, and then they died because they were at the end of it anyway. No,
yep,
go while you're healthy.
yep, yep.
Don't
And
wait till you're sick.
absolutely. Dr. Matthews, I just wanted to add, because people may have questions about the African American Heart Study. Even as you go to that website, which is our landing page, you'll learn how to self identify for that particular study. It's observational, there are no drugs involved. There's one visit to the doctor's office. We have doctors around the country that we can refer you to. Now, that one visit is more, you do blood tests, you do a physical exam, you fill out a survey, and we compensate you for your time at $125. So, but you have to look at that eligibility. We have a certain age range between 18 and 85. You don't have to have high LP little a to join the study, but we want to make sure that you don't have, if you're either what we call a case or what we call a control. So I encourage you, go to that website, share it with family members and see. This is one study, as an observational study, does not involve a drug, but will help us understand better how LP little a is affecting us as people of African descent. And I do want to commend the group that's called the RISE team at Amgen for supporting this kind of a study. We collaborate with the Association of Black Cardiologists, with Morehouse School of Medicine, and with a lot of doctors, majority of them Black cardiologists around the country, and some of them that are not Black but see majority Black patients. So it is a different way of doing things, and I'm just excited to be able to tell you about it, Dr. Matthews, and your audience.
Thank you so much. So that, I think that was great last remarks. I mean, she summed it up. She explained to you. Go to visit the website. Check it out. See if you could be a part of the study. I mean, if nothing, you get $125. But your information that you provide is going to help us to hopefully get some treatments for lipoprotein A, maybe, right?
Yep, it'll help us understand how it's affecting us. And then there are other studies that are looking at treatment, and
Yeah.
that would involve a drug study, which we're not. So,
Yeah.
yes,
Yeah.
excited.
So we gotta, every little step will get us closer and closer to that. And so, there was a time that the statins weren't anything to be talking about. Those are the drugs that you would usually take if you have high cholesterol.
Yep,
And they didn't exist one time. And then they
yep,
had to go through a process similar to this.
yep,
So please, and let me just tell you, I've done clinical trials myself, been a a person in the study.
Yep.
When I tell you that those consents are so thorough,
I know. I know.
many pages. But when I tell you that the staff that staffs the clinical trials, they are very, very, very knowledgeable, and they
Yeah,
will answer every one of your questions because they want to make sure that you understand everything before you sign. So
exactly.
they are going to be so thorough. And
Yep.
that's the other benefit of clinical trials. These people are going to take their time with you. Dr.
Yep.
O'Feely has to see so many patients in a day because that's the requirement. She has to see so many patients in a day. People
Yep.
have appointments. She got to get them in and out.
Yep.
These people with clinical trials, they're going to take their time. So can
Yep.
you imagine you're getting an extra doctor visit kind of
Yep.
by doing a clinical trial? So why not just
Yep.
participate in one?
Yes, indeed. You said it well, Dr. Matthews.
Well, thank you so much for your time today. I am so excited that everyone will now know what lipoprotein A is, and now they're going to all ask their doctors to check their levels
Thank
so
you.
that they all understand what they are because it's so important. And I bet you there'll be a whole bunch of lifestyle changes. So we already told you. Exercise, do you agree with exercising at least 30 minutes a day? Just
Yep.
getting your heart rate up, 30 minutes a day,
That's
5 days
it.
a week?
Walking. Yep.
Yep. Nothing. You could dance. And I always tell everyone you don't have to do the 30 minutes straight. You can break it up into chunks,
Yep.
3 chunks or whatever it is, but get your heart rate up.
Absolutely.
And
Absolutely.
then eat a balanced diet. Not
Yep.
everybody can give up meat. I'm not plant-based either. I understand. But we have to do better, you guys.
Yep.
We have to.
Yep. Yep.
And we have to also look at not frying everything.
Yes. Yes.
And I
Yes.
think the best invention was the air fryer because it literally takes like a tablespoon of oil and you can still have what looks like and tastes like fried chicken, looks like and tastes like French fries. So
100%.
let's just try and do things in a healthier manner. And I'm so excited that here at Black Doctor, we've had several shows about this, but we do have a nutritionist that is coming to do a wonderful series that in April that is going to cover all things with eating right. And she'll give you food demos too. So stay tuned for that. But you can also search back and watch some old videos because we've had lots of demonstrations about eating well. And we even had a show called Veganish.
Oh, wow. Awesome.
Right. So yeah, so please, it is so important. Your diet, exercise, and then of course, like she said, and I think that this goes without saying, smoking cigarettes is like the worst thing
The
ever.
worst. It's the worst. It's
It's
the
the
worst. It's the worst.
worst.
Yeah.
It's
Watch that video and hear my patient. He was a young.
yeah, it doesn't benefit you in any way, shape, or form. Like figure out another way for your stress to be, but it just doesn't help you. And it is awful for your heart and it's just so many things. So many systems in your body. So please, your lungs, just please stop smoking. So if you those three things, let's change our lifestyles and go into 2025 next year and everyone be healthy and
Yeah.
hopefully we'll have new information about lipoprotein A for next year's lipoprotein A day and
Yes.
that'll
We're
be great.
empowered. We're empowered. And thank you
Empowered,
for
exactly.
highlighting the Lipoprotein Day on March 24th. And I
Yeah.
hope everybody will get their levels checked as I did.
Thank you so much, everyone.